Tina Jones is a 31-year-old female who is currently working as the manager in a local restaurant. She lives with her husband, Calvin, and a 3-year-old son, Alex. Calvin has expressed concerns about Tina's health because she has had recent changes in her appetite and appears thinner and less healthy than she did a few years ago. Tina denies health issues and does not want to go to the primary healthcare provider because she believes that her symptoms are due to the stress of long hours at work and childcare.
Hello, my name is Tina. I'm here at the emergency room because I'm not feeling too well. I am breathing fast, I'm sweaty, and my heart is beating too fast. So my husband drove me straight here. My eyes have been bulging outward lately, and I have been losing weight. I have type 1 diabetes and take insulin daily.
Tina is shown to a room where vital signs are taken and labs are drawn. She has a temperature of 104.6, a heart rate of 138, a blood pressure of 185 over 105, and an oxygen saturation of 93%. The doctor prescribed 2 liters of oxygen on nasal cannula. The labs that were drawn were BMP, CBC, cardiac enzymes, clotting factors, COVID-19, thyroid function tests, urine analysis, and pregnancy tests. What came back abnormal was a glucose level of 250, WBC of 14,000, elevated T3 and T4, and low TSH. Cardiac enzymes and EKG do not indicate a myocardial infarction, and negative ketones in the urine do not indicate diabetic ketoacidosis.
Hi Tina, I know the doctor just diagnosed you with hyperthyroidism, and we are going to be transferring you to the ICU for treatment of thyroid storm.
And what is that treatment?
The doctor has prescribed several medications to treat thyroid storm. He ordered potassium iodide to lower the production of thyroid hormone. He also ordered propranolol to counteract the peripheral effects of thyroid hormone, methimazole and propranolol thioacetol to inhibit creation of additional thyroid hormone, and acetaminophen and cooling blankets to reduce temperature. We will also manage your diabetes with insulin therapy. So, I am going to begin by administering fluids and the medications as ordered and monitoring your vital signs every 30 minutes to assess improvement. I will continue to monitor your hemodynamic status and provide nutritional support consisting of a high-calorie and high-protein diet.
Since starting this, her vital signs have lowered. Her heart rate is 90, blood pressure is 130 over 75, respirations are 22, temperature is 99, and oxygen saturation is 100% on 2 little nasal cannula. After withdrawing labs, T3 has begun to decrease.
Hi nurse, I am feeling a lot better now. How is my health?
Well, 48 hours ago, you were in rough shape. But right now you are looking better. Your vital signs are still coming down, and your blood work shows that your thyroid hormones are still elevated, but they are not as high as they were when you first came in. Your elevated glucose levels are being managed with insulin, and you are looking to be discharged soon. And I'll provide you education on hyperthyroidism and taking thyroid medication.
A month has passed, and Tina is back in the emergency room.
Hi nurse, I cannot believe I am back here again. I think the doctor must have misdiagnosed me because I am having similar symptoms like I did the last time. I started to feel better, so I stopped taking my medication, and that's when these symptoms started.
So we ran all these tests again, and it looks like your thyroid levels are elevated. It also appears that you developed atrial fibrillation, as the doctor just mentioned to you. So we are going to start you on potassium iodide again, and we are going to need to add propranolol to treat your atrial fibrillation. I will also provide you more education on managing hyperthyroidism.
The nurse provided Tina patient education on hyperthyroidism and the medications involved in her care.
Thank you for taking the time to explain all of that to me. I know that hyperthyroidism means that I have elevated thyroid hormones due to a miscommunication between my brain and my thyroid. In my case, this is called Graves' disease. I will need to take my thyroid medications for the rest of my life. or else I will keep ending up back in the hospital. I need to take 1 pill a day in the morning before breakfast. Stress also plays an important role in my health. I need to be vigilant in managing my type 1 diabetes by checking my glucose levels regularly and taking insulin. I should also cut down on the number of hours I work, as I have been overworking myself lately. And I should be taking pregnancy tests regularly and using contraceptives because thyroid medications can cause birth defects. Lastly, I will regularly visit my primary care provider to monitor my blood levels and make sure the medications are still working for me.
Very good. All of that was correct.
3 months have passed. Tina will provide us with an update on her health.
It has been 3 months since I visited the hospital. I am doing much better now. I take my thyroid medication every morning. I take my beta blocker as directed, and I check my glucose levels on schedule and take my insulin. I have a weekly pill box, and I set reminders on my phone so I don't forget to take my medication. Calvin and I have rearranged our finances so I can work less hours at my job. My T4 level is still elevated, but this is expected because it takes some time for T4 levels to lower to a normal range. My primary care provider is still monitoring my atrial fibrillation. I have gained some healthy weight now, and my family and I are happier despite my healthcare scare, and I look forward to my future.